Ever had a nosebleed and wondered why? Nosebleeds, or epistaxis as they're known in the medical world, can be caused by a wide range of factors, some of which might surprise you. Firstly, one of the most common causes of nosebleeds is dry air. Low humidity or a dry climate can dry out nasal membranes, making them more susceptible to bleeding. Secondly, nasal trauma, which includes injuries from accidents, falls, or direct blows, can also cause bleeding. Thirdly, exposure to irritating substances such as smoke, strong odors, or chemicals can irritate the nasal passages and lead to nosebleeds. Chronic nasal congestion or frequent use of nasal decongestant sprays can also make the nasal tissues dry and more prone to bleeding. Similarly, nasal infections like sinusitis or upper respiratory infections can cause inflammation and irritation of the nasal passages. Allergies too can lead to nasal congestion and inflammation, making the nasal tissues more susceptible to bleeding. Certain blood clotting disorders, such as hemophilia or von Willebrand disease, can cause easy bruising and frequent nosebleeds. Some medications, particularly anticoagulants or blood thinners, as well as some nasal sprays, may increase the risk of nosebleeds. Underlying medical conditions like hereditary hemorrhagic telangiectasia or nasal tumors can also cause recurrent nosebleeds. A deviated septum, where the nasal septum is off-center, can contribute to nasal dryness and bleeding. Age is another factor. Children and older adults are more prone to nosebleeds due to factors such as thinner blood vessels in children and dryness in the nasal passages in older adults. Lastly, the prolonged use of nasal corticosteroid sprays for conditions like allergies can contribute to nasal irritation and bleeding. This might seem like a lot to take in, but it's important to understand the potential causes. If you or someone you know is experiencing frequent or severe nosebleeds, it's crucial to consult with a healthcare professional to determine the underlying cause and appropriate treatment. Interestingly, nosebleeds are often more common in the winter months. This is due to a combination of factors including low humidity, indoor heating, frequent colds and respiratory infections, increased use of nasal decongestants, and changes in temperature between outdoor and indoor environments. All these factors can contribute to nasal dryness and an increased risk of nosebleeds. So the next time you or someone you know experiences a nosebleed, remember that it could be due to a variety of factors, from dry air to underlying medical conditions. Understanding the potential causes can help guide you towards the appropriate actions and treatments, ensuring the best possible outcome.